The garden is important to me because it was a big part of our family. Every time we bring something to the table, we can proudly say, you know, this is what mom or dad or no taught us. Remember when we used to do this? No one can take that away from you. My mom's story began with an admission to a hospital downtown. She spent a total of 377 days in the facility. 231 of those days were awaiting placement. The time that it took to get to where she needed to be was too long. And in the process, she deteriorated and became ill, more ill than she was. And by the time she got a step ahead of where she was supposed to be, it was almost too late. She passed away. That is a sad journey for a lot of people out there. From a personal level, I believe ALC is the time when a person needs care the most, and that's where the services are lacking. The process is totally different. What you need to decide and the paperwork you need to do, and there was miscommunication. There was tension between the facility and us as well. A lot of the times it was guilt and fear that you weren't doing the right thing for the person. And those are things that are not taken into consideration, I don't think, in the definition. My outlook on ALC is a little bit different nowadays. When I look at a case and I search for ALC, I know what I'm looking for, that's my job, but I can't help to think about that person there, so I wonder what they're going through.
So the issue is that, and it's not just experienced here in Ontario, it's actually experienced all over the world. And it's interesting because we've studied the problem for a long time, but we haven't really studied the patient experience and the family experience. And I think it's really important to bring that to light because they really understand what the issues are, and they can also identify and tell us what they need and what we need to do better, whether we're a policymaker or a healthcare provider, or in my case, a researcher. It's important to work with them to hear their stories, and so we can start to build potential solutions together to help people during that transition period. A common response has been to build more beds or add more beds to the system, but that hasn't solved the problem because people fill the beds and you continue to have the same issue where people are getting stuck transitioning through the system. During the ALC period, patients they're confused about what's going to happen while they're in hospital waiting, and they're also confused about what's going to happen next. And same with family members. They find that they're not sure, where is mom going to go next and how will I manage as the daughter who's working full-time? And also the provider is trying to find a solution, whether it be in the community or a long-term care facility that is suitable.
I would like caregivers to understand that, to perhaps hear the voices that are out there saying what I'm saying today, and that we're more than just a data point. And only by understanding those needs will we be able to address the issues that we have today, make it better, and hopefully improve the future of the healthcare system.